So we can go ahead and establish the terms by charter because it's a new committee. 4 members will have a 4-year term and 3 will have a 2-year term. So I have a random pair generator. So we're just going to run everybody through that to see what the term assignments are. So Apple. Oh, you love to volunteer.
Bob Dalton to a lifetime term.
I second that. Okay, go ahead and click it, and then we'll see what happens. And then scroll down. Okay, so you just make a note. What the heck's happening here?
Man,
That's right.
Gary thought he threw me under the bus and he got 4 too.
And we prefer these to run concurrent with council terms, so the end dates are going to be December 31st for your respective years. And I will get the roster posted on the website with those appointment terms.
Thank you. I'm honored to do 4 years.
Alrighty, and then community partner presentation, we have the Regional Health Education Hub. Are you ready?
Do you feel comfortable having your presentation recorded?
Yeah, that's really fine. You can just make sure you're speaking directly into the mic.
Yeah, it's not picking up on our internal speakers, but it is picking it up in the computer.
I have to remind. Yep, perfect. All right.
You'll just want to move it like I am, just mimic what I'm doing. There you go.
There you go. This is going to be a challenge. I want to look back at you too. Okay. I'm Erin Solachek. I'm a Regional Health Education Hub Coordinator. We work across Lynn, Benton, and Lincoln County, and this is.
And I'm Casey Urrutia. I'm the Health Education and Engagement Manager at Samaritan Health Services, and our team provides the backbone support for the Regional Health Education Hub.
So Regional Health Education Hub, the focus is going to be on free health education programs that are offered across Lynn, Benton, and Lincoln County. I'm realizing we are in Lynn County today. So we'll talk about what the programs are, how our what our model is, and that's about it. Okay, why health education? So we do know many of our community members and ourselves have chronic conditions. We had a lot of partners within our 3-county region working on free health education programming in a siloed fashion. And so we came together to try to reduce not only costs for our community, but improve community health by offering these programs together instead of individually. Who makes up the Regional Health Education Hub? It is the entire community. Those that founded the hub are the county health departments and Samaritan Health Services, Medicaid or Intercommunity Health Network, our coordinated care organization. And our newest steering committee members are Crossroads Communities and Corvallis Community Center and Newport Parks and Rec Department.
Oregon Cascades West Council of Governments also is one of our county.
Thank you. Okay, so what does our model look like? Like I said, we're all working together to provide this programming. So our inputs, the left in the presentation, so that would be all of our payers, our community partners. Our key elements are in the center. So the work that we do together includes partnership and coordination. We do a ton of marketing. We have leaders for the health education programming. We provide the actual programs. We work on referrals and streamlining processes with organizations to get folks into programming. We have registration and roster management. We do perform data collection and entry, and then we're always looking on ways to fund our models. Partners or grant education programs that we provide. They're listed on the screen, but we'll talk more about what those are. So we are guided by a steering committee. We currently meet twice a year. We were founded back in 2018. At that time, folks were paid to come to the table. We did at that time meet monthly. So your model looks differently depending upon how the money's flowing for sure. But we are sustainable at this point and we meet twice a year. The goals are similar to what our elements were or our functions were in the previous slide. So really working on collaborating together to accomplish the outcomes or the programs. Okay. Casey, I think I'm going to hand it to you to talk a little bit about what our health education department does. So Samaritan's at the center of the work, and we do provide the backbone support for the model.
Yeah, so I think when we get into these conversations, it often is like, so who's doing what and how are we working together? So Samaritan Health Education Department's role in all of this work looks different based on which partners we're working with. So often it is connecting and registering participants for programming. We support getting folks connected to any resources that might be needed for them to participate. So that could look like transportation. Before COVID looked a lot like connecting folks with transportation. During COVID, it looked a lot like supporting folks and getting online. We coordinate annual schedules for programs. We train and support leaders. And we really are working to support relationships between our clinics and community partners who work towards common goals. I think some examples of ways that our partners are contributing to the model. I think a primary example is Benton County and the health navigating team provide leaders for our program. So Kelsey is actually one of our seasoned leaders for one of the programs we'll talk about later. And so each of our partners are working in different ways to contribute to the model's success. So sometimes that looks like leaders, like Aaron was saying, sometimes that's funding, sometimes it's referrals, sometimes it's offering space for us to host programs because the programs are offered to partners community members for free. There's not a whole lot of money to be made in health education programming. We are really working to leverage our partnerships to make it more successful. Our plan for programming right now, we are in the midst of reestablishing our programming in Spanish. Our goal really is to be able to offer all of the programs we support in both English and Spanish. For 2024, we have a really robust schedule planned, which is a blend of online and in-person programming. Which is really exciting. I think one of the positives that came from COVID was that prior to COVID, we were only offering in-person programming. And we quickly transitioned to offering online programming during COVID, and it's not going away. It has been a very successful way to reach folks across the 3-county region. We do have some data to support the work. So we were originally a IHN CCO delivery systems transformation pilot. And that's where we originally got our funding to really pilot. What does it look like to work together on this project? And that, like Aaron said, was in 2018. So we do track numbers. We were super successful going into 2020 and then the world changed and we went the opposite direction and we are starting to do a lot better at getting folks back engaged in person. As we're working with folks who have chronic conditions, it has been a challenge, especially getting folks to come back in person. We continue to have to get creative on how we're able to support that. Let me keep going.
I can take over.
Okay.
So what are we talking about? What type of on chronic? That comes in the form of living well with chronic conditions and Tomando Control de su Salud. So we're talking about similar programs, one in English. Activity. So designed to help people living with chronic conditions to actively identify challenges and solve problems associated with their illness. It empowers participants to take charge of their health by building skills in communication, problem solving, and action planning. So a lot of when you sign up, you have to sign up by the 2nd for the entirety of it because the connectedness that you build within the group is So you do a lot of action planning in here. You do a lot of setting goals and reporting back the next week. You do not have to have a chronic condition identified by a physician. I would say that the majority of us have a chronic condition. I know one of our leaders would say life is a chronic condition, right? We have challenge. You, she would say, I think, gain hope for living a healthier. The next would be Tomato Control de su Salud, the same as living well with chronic conditions. Term workshops. So we're looking at 6 weeks, 6 sessions, and 2.5 commitment. So not all folks are meant for these programs, but those that do come to them achieve great outcomes. We then have freedom from smoking. So as the title tells you, this is about tobacco cessation. So different techniques to support quitting. You do not need to be quit when you come to this workshop. There is a quit date set during the 4th week. Even if you do not accomplish that, to come back again. We know with tobacco that it is to be actively engaged and try again, increases the outcomes of staying quit long term. So a really encouraging class, and you develop a lot of skills to stay quit in this space. The next one would be around physical activity. So here we're looking at Walk with Ease or Camine con Gusto. So one in English and one in Spanish. Get to my notes so I don't jumble on for you guys. It's designed by the Arthritis Foundation. It's an evidence-based physical activity program proven to reduce pain associated with arthritis and other chronic pain conditions. I think this is also around increasing physical activity. So in general, if for anyone that's looking to increase physical activity, there is some learning that goes with it and then some walking. Online, like Casey mentioned, there are different options for these workshops. And then we land on diabetes prevention program, or called Prevent T2. Prevent T2, you're looking at making lifestyle changes. And there's a health coach along with other group members, and you're really targeting preventing diabetes. So you're in the beginning phases here. There are a few we can help. The department helps navigate what those requirements are. So there are some guidelines around this. You cannot have a diabetes or a diabetes diagnosis, for example. So you need to be in that pre-diabetes phase to participate in this workshop. A little bit different as far as commitment. We're a year long. So for the first 6 months, you meet once a week. And then the second 6 months, you're once a month after there, into kind of
really hard to build the capacity. So primarily right now, this program is being supported in an online fashion with the goal of being able to offer it in person at some point in the future. There's a lot of logistical things, barriers to that being able to happen. I'll just jump in right here if you want me to. So we're looking at a lot of different ways for folks to get connected with us. Our team at the Health Education Department processes referrals in a lot of different ways. Within Samaritan, that looks a lot like we're able to receive referrals from our providers, reach out to participants, get them signed up for the programs that make the most sense for them. Community partners can send referrals to us through Connect Oregon, and we have some partners who are on Connect Oregon and do so. We also have a website, email, and centralized phone number that anyone can call, and we're able to respond to messages actually both in English and Spanish. So really looking for like no wrong door. We love to have processes in place to make it easier for everyone to get connected. And Epic and Connect Oregon are typically those ways, but we also can get people plugged in however they get a hold of us.
Participant feedback, so success from our participants, success from our partners. I'm not going to read through them all. I'm happy to share this slide deck out with anyone that's interested in having it. Really, our ask of you all is to partner with us. So whatever that looks like for your community. So specifically Sweet Home. We do have flyers that we can share with you all to be posted. We're open to having conversations around referrals. So if you work within an organization, you want to develop a referral process, we can help support that. And in the end, just really, how can we best support you and regularly communicate with us on how we can do better, any areas of opportunity for improvement? We're here. And I think that's it. And I will pass out some flyers. And there's also, if you're a provider,
Someone, I would say not.
I don't-
Someone who would be making a referral, like sending people our direction. We do have these, we call them provider handouts, but we use provider term pretty loosely.
super loosely.
So anybody who may be directing people to us, this resource here outlines each of the programs, what the topics are included, who the target population is, and then how to get connected with us. So a lot of the information we talked about today is all on this. This isn't really intended to be like on the walls for public to see, but really as like a cheat sheet for anyone who might be wanting to connect folks. We have our handbills that we can pass around, which has information about each of the programs, QR code on the back. We have our general health education workshop flyer that can go wherever y'all want it. We have individual program workshops as well, or workshop flyers as well. So if there's any need for more specific program information, we can get that to you all as well.
Madam Chair, may I?
Yeah.
So you two would be disappointed if I didn't at least notice that right in the first page, when I was reading through it, it says for patients with chronic conditions, you're not including mental health conditions, which is my thing.
So I think that the Living Well with Chronic Conditions program is designed for folks, and maybe Kelsey, you can jump in here too, since you are a trained leader. I think that there is some mental health conditions that it would make sense for, it would be an appropriate space to be able to deal with chronic mental health issues, but I do also think that it might not be the best fit for everyone.
Yeah, I agree. In some of the workshops that I've helped kind of facilitate, there is times where we've seen people who have a co-occurring condition. For the most part, I don't believe it is necessarily the best space for certain mental health conditions if that's the only treatment they are seeking.
So back when you guys were in middle school or whatever, there was a slight shift in trying to encourage people to think of serious mental illnesses as actual brain disorders, which is that physical side. So I actually kind of agree with the direction you're going in. But I just wanted to point it out. It's
big. It's a big
conditions
thing.
is, you know.
It is very big. And I think that that is what I think. I appreciate you bringing that up, Dick, because I do think that there is a population that it is a good fit for. And I think folks who are working individually with folks probably have a good sense on if a group workshop facilitated by their trained leaders in the program and sometimes have skills to help folks navigate complex situations. And sometimes they don't. So sometimes the minimum requirement to lead Living Well with Chronic Conditions is that you too have to identify with having a chronic condition. And it really is one of the community type programs. Like that's the intent of it. But we do have a lot of folks who have skills in navigating those situations.
I know of too many people that struggle with bipolar and ADHD stuff that lasts their entire lives. And that actually affects the physical part as well.
Oh, absolutely.
So, you know, I'm not expecting you to treat it yourself individually, but it just kind of broadened. I saw the numbers that went down and
Yeah,
you're still building up.
Thank you.
It's okay, but like I said, I'd be remiss if I didn't say it in front of you.
I expect it.
Does the committee have anything else for the Regional Health Education Hub?
So I have a question. So the meetings or the sessions are typically held in Lebanon, I'm guessing?
That's a good question. No, they're actually throughout the 3-county region. So our online programs are obviously open to anybody within the state of Oregon. We have hosted programs in Sweet Home. We've hosted Living Well with Chronic Conditions. We've hosted Freedom from Smoking here. I think those are the two a while ago, we offered a like living well with chronic pain that we took place here in Sweet Home. Some are happening, yes, also in Lebanon,
Mm.
but then across the other 3 counties as well.
So if somebody had a space that they could offer you, then you would be interested.
We would be interested, yes, very much
So
so.
looking at scheduling right now into 2025. So I think that is something for a group like yours, maybe if chronic conditions is identified as a priority area and you would like to see programming happening here within Sweet Home, that is something to connect with us, and we can definitely, we want to have programming where people are. So like multi-unit housing is a great example. So having programming in a community room in a multi-unit housing space. So folks, it makes it easy for them to come into that space. But wherever people feel comfortable, we want it to, that's how we have the most success.
As the facilitator who used to facilitate in Sweet Home and we have since lost that space, surely if you have space, I think that is great. I'll just
Senior
throw that
center,
out there.
but anyway, I'm not going to speak entirely for it, but
Yeah.
yeah.
And if I might, one of the things that came to my mind that made me think of you two guys is the new clinic opening, and they have
They have
space.
education rooms, yeah.
So that
they do.
might be a connection that you guys could, just have it available once a month or whatever.
Yeah, Wiley Creek right next door.
Yeah, I asked them about it, and it's the same thing. Well, I can't volunteer it, but it's a good idea. So
Yeah, our team, we often reach out to community partners and connect ourselves. So if you all have leads on people that we should be connecting with, we're happy to explore what those partnerships or relationships could look like. So feel free to connect us. Uh-huh. Yeah, that's a really good question. So for the programming that the health education department supports, if we had someone referred to us who had diabetes, we would recommend living well with chronic conditions because that is a totally fits within there. I think from a larger like Samaritan or Benton County perspective, there are diabetes education departments and maybe other specific programs that are available to folks that kind of are outside of the health education department. Mm-hmm.
Alrighty, moving on to our next presentation.
Okay, is this going to be okay? Leaning like that? So good afternoon. My name is Shelly Alinari, and I'm the Director of Business Development for Samaritan Treatment and Recovery Services. And I'm just going to give you a brief overview of our treatment facility in Lebanon. So Samaritan Treatment and Recovery strives to be the program of choice for our community and all of our families and our patients. We offer services for adults 18 and over. We have a 16-bed residential treatment center. We have intensive outpatient and outpatient groups, depending on that level of care that's needed. We follow the Mental Health Services Administration, the SAMHSA, that recovery emerges from hope, is person-driven. It occurs through many pathways, holistic and supported by peers and allies, culturally based and influenced, and then we are addressing trauma. So our services that are offered, we have groups in the morning and evening. We have day treatment groups for ongoing support and education, one-on-one counseling, DUI, medication-assisted therapy, and then, of course, our 16-bed residential treatment facility. So how do we triage? So everyone that is referred to STARS gets an assessment done, and then we also take walk-ins. After that assessment, they are offered the level of need that they qualify for. And if it's residential treatment, they are added to the wait list and then offered our intensive outpatient services. And we do see the patients that are the highest acuity first. We follow the ASAM guidelines, which is pregnant women, IV drug use, and unhoused is the very top of the list. Then pregnant women and unhoused, or women IV use who have children. And then on the men's side, it's men, IV use, unhoused, and HIV, and then men, IV used, and unhoused. So our current funding sources, of course, our community partnerships, so the most important, and then donations. And of course, the Measure 110 funding was a huge impact to STARS. We have 3 different grants that we're currently working with. The RC Sway grant for women with children or women who are pregnant, and our burn grants for Lynn County, and then a burn grant in Lincoln County. Our goal is to be self-sustainable. We're not quite there yet, but very close. Okay, so how do you refer to STARS? So if you're in Samaritan, there's an internal referral process, and that's a little picture of the Epic. Sometimes I give this presentation to Samaritan. We do take walk-ins, like I mentioned. We have peer supports like Candace, she's one of our peer supports. We have an email called starsprogram@samhealth.org. And then we also have a phone number or a fax number. So just like mentioned, no wrong door, just any way that they can get to us, we have it open for them because it's so important. We want them to contact us and be able to meet them where they're at. All right, how do we do it? So how will we support our patients? So we have 7 residential support specialists. These staff support the residents by being their mentor, help with skill building, walk alongside them in recovery. They attend AA, NA meetings with them, drive them to appointments, do arts and crafts, and show our residents appropriate pro-social skills. And we are a 365, 24/7 facility, and we run 3 shifts, and they help with all the day-to-day tasks. We also have community peer supports, and they work with the residents identifying strength-based goals, help them negotiate expectations of treatment, teaches and models the individual recovery experience, and helps residents just in general. So we have 2 peer supports at the coast. We have 2 in Albany and 2 in Lebanon. And in 2023, our peer supports provided 570 unique clients, equaling 1,048 different services. So we do tabling events. And this is one at Sweet Home Library and then at Chance. And that is Candace and Chanel on the pictures. She's shaking her head no. And then we also have certified drug and alcohol counselors. They do assessments, trauma-informed and responsive care, provide clinical consultation to referrals. They run the process groups, monitors clients' treatment, and then learn about barriers. So we have 6 counselors, some residential outpatient and intensive outpatient, and then we have 1 counselor for medication-assisted therapy. And in 2023, we had 80 admissions, 42 completed, and 38 did not.
That's not bad.
We also partner with Capital Dental. And a dental van comes out 1 time a month to see our residents. And then we also have a hygienist that comes over from the hospital. I believe it's every Thursday. And this is our corridor of courage. So when a residential patient leaves recovery, they put their handprint on the in the door walking in, and they put the date, and that's their graduation date. So it's very neat. And then our residential garden. So you can see that it's learning how to make things grow, learning how to care for things, learning how to take time with things. Because sometimes, in addiction, we want things right now. And we are, just that human nature to just that instant gratification. And so learning how to take time with the plants, it really helps them just learn and grow. This is some of the artwork. That is a diamond dot of our STARS facility, and then some cardboard creations. And now I have a story of a resident. This picture is currently hanging in the hallway at Samaritan Treatment Recovery in Lebanon. This came from a young gentleman that was houseless, came into treatment and discovered in one of our art classes that he was an artist and that he was amazing. He is amazing. He drew this. This picture is about this big hanging in the hallway, and he's painted elephants, pictures of the sea. Trying to remember everything that he's painted. Owls like you see here, and then another one, it's this view of the trees. Just it's beautiful. So this is a great example of how coming into treatment you can discover hidden talents, and hidden talents that not only just make you believe in yourself, but he just brought us another painting. He brought Stars and the Coast, another painting just yesterday of a huge anchor into the sea, because we say we are your safe harbor. So it's just really nice. And he dedicated this to the treatment recovery at the coast. So it's really great. And so the future for Stars in Lincoln County. So we have a 16-bed residential treatment facility, planned completion in the spring of 2025. It's going to be the same services that are here in Lebanon. It's a much bigger building, so we are going to be able to have a gym there, because currently the Lebanon patients are able to go to the Sam Fit in Lebanon. But yeah, it's going to be beautiful, another 16 beds, so we're very excited about that. And this is our progress so far. And from what I've learned, that when the trailer is on site, that is when the magic happens. So so we're very excited, and I think it's come farther along a little bit more than this, but I don't have any more recent pictures. So we're very excited.
I was wondering if you're involved with this. The Lynn County extends mental health outreach that was in our local paper to, it's a mobile crisis intervention team, and they're going to be getting a van and going throughout the county.
Yes. Yes. I have heard about that. I haven't seen the van yet. I was gone when it came to our parking lot to show it off.
Because there wasn't any contact information in here, but I presume it's because it's still not off and running.
Yeah, it's Dana, isn't it? No, who is it?
They need to get set up in there, and then as soon as they are out, we will start, one of us peer supports will start going out with them.
That's super to hear about that, because it's, it's that outreach. People don't want to come in, so if you can get to them, then they may come in.
Yeah, that's what I think one of the things that's making our peer support so successful is that they are out in the community, in the trenches, going wherever the patients are to help take care of them. Yeah.
Cross-pollination.
Yeah.
Oh.
Mhm.
Yeah.
Yeah. Yeah, working a lot with Sean.
Yep.
Yep.
Oh, yeah.
Cool.
Exciting.
Yeah. Oh, great. I just saw that. And I thought I'd asked about it, knowing the presentation today.
Do you have any providers at the new Sweet Home Clinic that are offering mat services as like outpatient services? Okay. Okay.
I don't believe so, but if they.
I know
refer-
previously there was, and James Page was connected, and he was a contact that we had that we were working with, and he had come to a few meetings. But then COVID happened and we stopped meeting, and so I just didn't know if there was currently providers offering that
Yeah, well,
here.
we do. He's also a hospitalist over at Good Sam, and we're working on starting a inpatient consult service.
Okay.
SUD and co-occurring disorders, and because we don't ever get anyone that only has substance use. There's always co-occurring or triple occurring. My new word.
Back to what we were talking. about.
I do think that there is an opportunity too. These evidence-based programs work really well and I think that there's some opportunities for us to explore. Are there better leaders for some of these programs for more specific populations? And so if there are groups of people who are meeting and could benefit from a living well with chronic conditions workshop, I think that that's something that.
Anything more from the committee for the presenters? Yes. Thank you. Emergency family housing presentation. I assume that's Kelsey.
That's me. So before I get started, I just want to say I am so happy you all are here today. And besides even, actually, Adam will just run it for me. He knows me well enough. And listening to some of this stuff, it's so exciting. It's just like what Sean was saying about all the cross-pollination and pieces. So I'm also glad that you all are going to hear about doing here. Because I would love to partner in some way with all of this too. So, okay, good, you're not recording me. Because all of this is still in process. So I want to make that very, very clear. And all of the various pieces that we are working through will also, some of these pieces are still going to have to go back and they're pending council approval and so forth. So just, that's the caveat that this is what we're working towards. This is the tentative plan, but there are some things that may shift over the next little while. Okay. So about a year ago, actually, I was realizing the Council of Sweet Home declared a state of emergency regarding our homelessness. And what that ended up creating was Lynn County declared a state of emergency. And there ended up being additional funding, and we created a MAC group and became very involved in that on working on getting additional resources in Sweet Home for our homeless. And we were focused primarily on a little bit more background. Sweet Home and this committee and the council and so forth all had worked with Family Assistance Resource Center on developing the shelters that's there. And that allowed us to move the folks that were by Old City Hall and also on other streets over to that area. And we've been partnering with that consistently. But what we discovered is that sort of opened the blinds on the next phase that we also needed to look at. We still have additional houseless, and we have quite a few families here in Sweet Home that are in tents, in vans, in people's garages, in various spots. And so that is sort of where all of this came about. So we've been working with Lynn County gave us some funding that we've been working with CSC. And so we just purchased some shower trailers and some laundry and a laundry trailer. And one of the shower trailers is going to be placed right by our police department, and another, the laundry trailer and the shower trailer, the other shower trailer, we're still working with FAC on potentially having it placed there. And that's the current. But we also received from the MAC group, after submitting our application, additional funding, about $500,000 for emergency family shelters and some transitional pods and some case management. So we have an RFP out there right now for our case management, and it's in two areas: family housing and also the pods that will be placed at FAC that'll be sort of a transitional housing, as well as looking at rapid rehousing. So if you all have anybody interested, please send them our way. If we don't find anybody, we've also thought about potentially having a position here at the city that would be temporary and be grant funded. So, but moving on to the family housing, our overall concept is that we'd start with about 4 to 6 units. And those units would be differing sizes. So some of them would be families that might just be 2 or 3 people, up to 4 people. But one of the biggest challenges we've seen is we'll have families, about 8 family members, and there are not shelter beds for them. And so they end up on really long waiting lists, and they end up in vans or multiple cars or tents or other situations. And what's also really challenging is they have really little kiddos who are needing to go back and forth to school. And I've witnessed and seen many stories of these kiddos who are not able to then function during school because they're just focusing on survival. And if we are going to really look at our houseless population and how we can make a difference there, we have to start at the family level, and we have to really watch out for these kiddos. So this is what we're trying to do. And what we're looking at is some shelter spaces that provide dignity and privacy. So they're small, but they will have bathrooms and kitchenettes and electricity and heating and cooling. So, and we're, like I mentioned, looking at 4 to 6 units. I actually have a call with a provider tomorrow on providing me with the quotes on the ones that I've been looking at, like full on. So this is one that would be for a family of 2 to 4. So again, it's small. I mean, this is not going to be a long-term housing solution. This is an emergency housing solution, but this is a start. And full bathrooms, there'll be a little bit of a kitchenette and probably a bunk bed or fold-out futons, things along those lines. But again, it's a lot more comfortable and it's a good start. We are also looking for management that would be providing food for 3 meals a day while they're working on this, on getting situated for something that's more long-term. And then this one is one that could potentially go up to a family of 8. Again, it's only 320 square feet, but with bunk beds and a small kitchenette and a bathroom, this is again much better situation than some of the tents or vans. This is a second option. I tend to really like this one because you could possibly split it out to 2 bedrooms, you know, boys and girls, or have bedroom and living space and so forth. So again, we're going out for bidding. So this is just a potential floor plan. It's just one of the many suppliers and vendors that we're looking at. And all of this would have to then be approved by council, and it also would have to be approved by the grant funding. But this is what our conceptual plan. Which leads us to the next piece. So the city currently owns this property. And so what we're looking at is we went ahead and tried to develop something that, if this is successful, could potentially grow. So on one side, you can see 4 of those 40-foot units. We'd probably start with 2. But we have a site plan that could allow for 4 if this ended up being successful. And then on the other side, you can see 6 of the smaller units. In the middle is an area where we are currently looking at picnic tables, potentially grow boxes, for the exact same reason that you were talking about earlier, on being able to have that sort of sense of accomplishment, permanence, and just make it feel like home, even if it's only for a little while. We'll have parking out in front, and not far from that area, about a block away over this direction, we're looking at putting in a community park as well. So this is, I think, something that would actually be beneficial to the neighborhood. It's possible that we could have a little playground in the middle there. I'd love to see something like that at some points. And we have options to continue to expand this if it ends up being successful. We are also looking for, wait, I'm not done. Go back. There we go. We are also looking for volunteers. We're going to be able to go ahead and get these structures in there, but we are going to want to paint them, and we're going to want to possibly have little white picket fences and things like that make this a community not only for the residents, but for those surrounding neighbors and so forth, so that this is something that feels comfortable and safe and is a positive piece in our community. All right, so that's the emergency family housing. Any questions on that before I move to the next piece? Okay, cool. Let's move to the next piece. Okay, I do not have good pictures of the pods. So I just grabbed an example of one of the things that I've seen work in some other spots. We are looking at pods that are just a little bit bigger than what FAC currently has. And they are that next step up. They would have power and they could potentially hold 1 to 2 people in them, so that it could possibly hold a couple or just one person. And the idea that we have been discussing with FAC, or if it ends up going elsewhere, but at the moment that's our current plan, is that this would be for residents who have been at FAC, who have been successful, who are ready to start looking at long-term housing, but who need a little bit of support in that next step. So when you move from shelters, and I don't need to tell you all this, but you all know this already, but it can be a very emotional process, and it can also feel very lonely. And it's a huge step to go from something like some of the huts to an apartment. And so this is a little bit of that next step while they're getting to that point. And it's also the idea is that it would be an incentive for those that have been following the rules, that have been doing well and are ready to take that next step. So we wouldn't be managing this, FAC or whomever else ends up responding to the RFP. So they may shift that a little bit, but that's the current thing that we're looking at for this particular piece. And we're looking at 3 to 5 pods. Honestly, it's coming down to finances. We have received that grant, but all of this is expensive, especially when you have to do management. And while there may be some additional funding, we don't want to overcommit to anything. We want to make sure it can be successful. So that's it for me. Any questions?
Area or road area?
So the family housing would probably be closer to high barrier, but the pods would still be low barrier, just going up a little bit. Uh-huh. That's fair. And you can ask him here too. Okay. Okay.
Any questions from the committee members?
Anyone want to volunteer?
I heard Bob Dalton is interested in volunteer. I don't know
I
if
think it's good to have the high barrier on the family units to provide that safety. Because it's really hard to have people that are using when families are trying to make it or stay clean or.
That's good to hear. Thank you. That was kind of where we were going with this, with the high barrier.
Yeah.
And particularly, we want this to be a safe place for kiddos. That's a big, big piece of this.
I don't know if you're aware, in Albany, they're doing what's called the Hub City Village.
I am.
Yeah. And I'm donating to them because I have friends there that are twisting my arm. But anyway, that's similar concept, except people will be living there long term. And if they find something better or something different, then they can move into that. But it's for the same population. And they're looking to open in the fall, like September.
That's perfect. That's when we're looking to open as well. Probably October for us. Right? Yeah. That's great. It's nice to hearing. I think it's critical that multiple cities do these
Exactly.
things. We can't have any just one city try to carry this.
And they're kind of modeled after Eugene, so yeah, so a lot of people are doing this, which is great.
I figured you didn't. Alrighty. So we are done with new business. Is there anyone from the audience that has anything for the committee?
we can be telling our clients, here are some other additional support that we can help offer, or probably see a lot of the families and a lot of their kiddos were really struggling. So those things. So that's kind of just like our piece. We just want to show our faces that we're over there on Long Street.
We have some pamphlets. Yes, we have pamphlets. So yeah, we're kind of increasing our services over there on Long. We're gonna have some more providers coming in so we can see more clients. Sydney and I have some pretty open availability for the child and family therapy side, so we can see some really, really young kiddos up until 18. We have a really good partnership with the high school that we're enjoying, and we're just looking to get more involved in the community that we serve. I'm originally from Sweet Home, so I'm happy to be back and helping, and I'm really proud to see all of what you guys are doing so far.
So if I might, Madam Chair, Sandy Minta is going to join us in May, and hopefully you guys can show up with her. She's the program manager for mental health in Lynn County, and had thought exactly this, to have somebody from the various programs in her old building come and talk to us about what they're offering, not just in children's, obviously, but this is perfect. Good of you to show up.
Welcome. We're
Yeah.
glad you're here. Anyone else? Okay. So moving on to old business, the community resources list. Yeah. So I've been working on it. Your list was extremely helpful. I know like our address and phone number have obviously changed, so I was able to update that. And then I've just really tried to reach out to a lot of the businesses that we currently have listed, go to their websites, make sure their websites are active, because I don't want to put it out to the city that we've had a finalized list and the numbers are wrong, the addresses changed. And I am also thinking about like, what do we want that to look like? And is there a deadline? Because that has not been discussed. It's very tedious work. I also work full time and have 2 kids. So I'm doing the best I can, but it's a lot. So I just want to bring it back to the committee and say, what is our deadline and what are we ultimately wanting it to look like? Because it can start to get really messy when we have the hours that they're open and the days of service. Do we want just the information for the basic services that are offered, the web link if they have a web address, the phone number, the address, or do we want more information?
I would say keep in mind that one of your goals is to review that quarterly. So just don't put so much that a quarterly review is going to be too onerous to accomplish.
You might also, you may have already done this, but you might tie into the vendors who come to the health fair meeting.
I was really hoping Bob Dalton was here
Well,
because he has a very extensive list of those
Do I,
vendors.
so I'll play with you too.
Thank you.
Okay. Maybe if you could share how far you've gotten and we can just compare. That would be good.
If I can make a suggestion, I would just suggest keep it simple. And don't worry too much about like things like hours because they will change.
Yeah.
And if you just have resources out there, I think that's already a huge improvement.
Yeah. Agree, resources and a phone number, and then they can contact and
And I'll say too, by code, technically the codified committees are supposed to present their annual reports by April 1st. Obviously you're a new committee, so that's the expectation. But if you wanted to include it with your next April 1st report.
Next April 1st sounds fantastic. I think I just had a mini stroke. I was like, oh, that's soon. Next April 1st. Yeah, let's do that. No, I think it's good to have the web addresses too for people if they're obviously going to the city website to find this information, if they can click on the link and find a more specific service that they're needing. And then I was thinking of just grouping them by service. So like the medical pieces will obviously be together, food resources, there's a lot of organizations that do several different pieces, but I think if we include the phone number, the address, and a web link if they have one, people are also resourceful and can find the different resources on the websites as well if they're not finding exactly what they're needing. Does that sound good? Okay. Thanks, guys. That's all I had.
So I was gonna say something about April. Is that okay?
Yes.
So we're trying to get the med school to show up in April, both the med school and then the new occupational physical therapy folks in Lebanon. The program in Lebanon has now in its third iteration of changes at the top. Not the top, but the folks that are interested in coming here. And the hope is to work with Dr. Jeannie Davis, who some of us know rather well, actually, in various capacities. And she works mostly with the main school and is going to try to get the two schools to work together and both show up in April and kind of present what they're doing and what their connection is with the community. I've talked with Shirley about having some kind of interaction between the PTOT folks and the senior center, the Boys and Girls Club. Again, two iterations of people are very interested in doing that, but we have to get somebody who's willing to pay attention. It turns out that the programs, the way they run it at the school, the students actually have to pick a direction that allows them to provide community service. And one of the obvious paths would be to either work with this community committee and or other parts of the community. And the whole tie into the senior center and Boys and Girls Club makes a lot of sense. I pointed out to them we used to have an annual run at the health fair. It'd be nice to have them involved, get their energies up and get the community involved in a run, things like that. We've done before. Again, the pandemic kind of cut the socks off of a lot of us. But people really are up and wanting to do this. And in the school environment, they're required to do it. There's a certain number of hours they have to provide to the community across 2 years. So they're just, sitting out there waiting to be grabbed. So in April, we should have both of their representations here.
I have the exercise group. I've talked to them and they're like chomping at the bit. So when is that person going to come talk to us? Because they want safety in the home and everything else. And so when the director's on board with it, I've got everybody on board with it. So I'm just kind of waiting in the wings.
The last note I got, they've actually picked somebody to run that now. They didn't have that before. So.
Do I just say I adjourn? Okay, we're adjourned. This is the first one. I was button bullets. Get a little nervous.